Let's go over general inspection and vital signs. General inspection will include patient's physical, emotional, and mental status and behavior. Begin your initial observation for baseline data immediately when you meet the patient. Your initial impression should help guide you towards areas that require further examination. Does your patient appear healthy? Any obvious findings? For example, if your patient appears older or younger than they stated, you might consider possible causes like drug or alcohol use, excessive sun exposure, chronic disease, or endocrine disorders. Note their skin color and condition. What is their hygiene like? Do they appear clean and well-groomed or disheveled? Is there any odor detected? Look at their body structure, body movement, and position, and notice any limitations there. A patient who is having difficulty breathing may sit slightly forward, bracing the arms on his or her knees in tripod position. If someone is in pain, they might exhibit guarding or they might assume a fetal position when lying down. Is your patient alert? When they're talking to you, note their tone of voice. Does their behavior, emotions, mental status seem normal? Are they making eye contact as culturally appropriate? What is their nonverbal language like? Is their clothing appropriate for weather? Your baseline data will also include vital sign measurements like temperature, heart rate, respiratory rate, blood pressure, oxygen saturation level, height, and weight. And in some settings, their height and weight might be stated instead of measured. Pain is often included with the assessment of the vital signs too. Let's talk about temperature. Body temperature is regulated by the hypothalamus, and temperature changes occur as a result of normal variations and activities. Temperature can be measured by different methods. So when you're checking oral temperature, I need you to keep in mind any factors that can alter that reading. For example, smoking, patient recently ate or drank something hot or cold. These things will impact accuracy of measurement. So wait at least 10 minutes before taking an oral temperature to avoid impacting the temperature reading. When checking tympanic temperature on a patient, if your patient is an adult, pull up on the top of the ear. And for children and infants, pull downward on the earlobe to help straighten the external auditory canal to ensure the accuracy of measurement. For rectal temperature, these readings are about 1 degree higher than the oral readings. They reflect core body temperature, and that reading is considered very accurate. I need you to read in your textbook on positioning of the patient for rectal temperature. For axillary temperature measurement, this measurement has questionable accuracy, but it is still used in clinical settings. So axillary temperature reading is normally 1 degree lower than the oral temperature. So if you have your oral temperature as your reading is 98.4 degree Fahrenheit, okay? So if you had to change it to axillary temperature, what would you do? So here is your axillary temperature. You will subtract 1 from this reading. So it will be, if you had to document it in axillary temperature reading, it will come out as 97.4 degree Fahrenheit. Now, if you had to convert the same to rectal temperature reading, here is our rectal temperature. You will have to add 1 over here to give it accurate rectal temperature reading. So it will be 99.4 degree Fahrenheit. So let's just say this one is 0, this one is +1, and this one is -1. I need everybody to be very clear about this concept.